Hi, my name is Mackenzie Mazurek, and I'm going to be presenting on celiac disease. Celiac disease is an autoimmune response to gluten. Gluten is a protein that's found in foods containing wheat, rye, or barley. This disease occurs primarily in the small intestine, causing damage when the body is exposed to gluten. So, celiac disease is when the body has an immune response to the consumption of gluten, and this stimulates intestinal damage and can lead to serious complications if left untreated. So, some genetic factors that contribute to celiac disease are family history, certain genes, and certain disorders. So, family history is going to be a big one. So, celiac disease is largely hereditary, and your risk is going to be up to 10 times higher if you have a relative with celiac disease that's your first degree relative. If your second degree relative has it, your risk is a little bit higher and higher than it would be if you had no relatives with the disease. So while it does run in families, it has not shown to follow an exact inheritance pattern. So some other genetic factors are going to be specific genes. So these are certain variants of the human leukocyte antigen. So it's going to be HLA-DQA1 and HLA-DQB1 as well as 2. These genes belong to the human leukocyte antigen family, and around 95% of celiac patients are going to have a variant of the DQA1 gene, and this gene plays an important role in autoimmunity. And other certain disorders can also increase the likelihood of developing the disease, and that's going to be Turner's, Downs, and type 1 diabetes. So environmental factors, lifestyle factors, infections, toxin exposure, and bodily changes are all going to influence this. So gluten consumption is going to be the main trigger for celiac disease. Also, it can be caused by, it can be developed in response to extreme stress if the genes are already present. Infant feeding practices are also known to delay onset if done in a certain way. So postponing gluten introduction for a few months may help delay the onset. It can't prevent the onset, but it can delay it. So infections and microbiome, enterovirus and adenovirus infections have been linked with the development of celiac disease, especially in early childhood, as well as impaired gut microbiome. So this has been known to play a role in symptoms. So toxin exposure, young adults that are exposed to chemicals such as pesticides, flame retardants, and nonstick cookware have an increased risk for developing celiac disease. Pre-existing autoimmune conditions. So it's known that if you have one autoimmune condition, you are 25% more likely to develop another. Pregnancy can also trigger this. So some demographics, women make up 60 to 70% of the patients diagnosed with it. It can appear at any time, and the average age is about 40 to 60. So ethnicity, it's the most common in Caucasians of European ancestry and rare for African Americans, and incidence rates are going to be highest in Europe and Australia. So celiac disease affects the small intestine, which is an integral part of the GI tract. It's located in the lower part of the abdominal cavity. It's going to be inferior to the stomach and surrounded by the large intestine. This is composed of the duodenum, jejunum, and ileum. The small intestine is lined with microvilli. These are small hair-like projections that line the small intestine and aid in nutrient absorption. So they also form a protective barrier against bacterial infections. They aid in nutrient absorption by increasing surface area. So the more surface area there is, the more nutrients get absorbed. In celiac disease, the autoimmune response causes damage to these villi, so they actually end up losing their shape and flatten. So as a result of this, food cannot be absorbed as well and nutrients cannot be absorbed as well. So some symptoms are going to be chronic diarrhea and constipation, gas, indigestion, and bloating, and stomach pain is also going to be a symptom. So weight loss is going to be a symptom, cognitive symptoms, so depression, anxiety, neurological symptoms, so cerebellar ataxia, so loss of coordination, headache, epilepsy, unexplained low blood counts, reproductive issues, so miscarriages, infertility, missed periods, skeletal issues, dental issues, all going to be main presentation of celiac disease. Also integumentary issues, so skin rash, hives, and dermatitis. I actually have celiac disease, and I found out because I had a skin rash. So physiology, so flattening of the microvilli, this is called villus atrophy, leads to impaired digestion and inadequate nutrient absorption. And it doesn't matter how much food is consumed, you're not going to be able to absorb the nutrients until the damage is healed. So villus atrophy also impacts medication absorption because a lot of drugs are absorbed in this area. So it's going to be classified by 4 stages, and this is based on severity using a scale called the Marsh score. Most celiac disease is diagnosed stage 3, and a lot of practitioners won't diagnose it until it's stage 3. So this is characterized by an increased amount of lymphocytes and larger depressions. So long-term consequences if left untreated: malnutrition, osteoporosis, infertility, nerve damage, extreme nutritional deficiencies. Your life expectancy, if it's treated, is going to be normal. So diagnosis, a blood test is going to be the first step in getting diagnosed. So they're going to check for antibodies formed against gluten in the blood. And then you can also do genetic testing to check for HLA-DQ2 and HLA-DQ8. So endoscopy and biopsy will be performed next. So that's just where a long tube is inserted into the oral cavity, down into the intestine. And the biopsy will be reviewed by pathologists who will grade it using the Marsh score. So treatment, the primary treatment of celiac disease is going to be a lifelong, strict gluten-free diet. That's the only known treatment. So this includes avoiding cross-contamination. So you can't, people with celiac disease cannot eat in an area that other foods containing gluten have been prepared. So monitoring, so you're going to continue to screen for vitamin deficiencies, meeting with a dietitian, repeated endoscopy to make sure that there's no damage that's reoccurring. In some cases, refractory celiac disease can occur. Refractory celiac disease occurs when the diet has been altered and there are still symptoms. So even though, there's strict adherence to a gluten-free diet, extensive damage has occurred, and you're going to have symptoms. So currently, artificial intelligence is not used as a first line of treatment or disease detection, but it is used sparingly. It has great potential for pathological assessment, biomarker testing, and diagnostic imaging, but not yet. Okay, and that's it. Thank you.